All right, what's going on, everybody? Good morning. This is Dr. Damien. I'm coming with your YouTube video for today. Like I said before, I'm going to be doing a new series in which I kind of go over the ABCs of common medical diseases, or most of the things that people ask me about on a routine basis. A little background on myself. I'm a family practice physician here in Houston, Texas. Been practicing for over a decade, and I deal with a lot of the common medical conditions that people have over and over. So yesterday I did arthritis, and I'm going to go through the ABCs today. I'm going to do B, which is for blood pressure. I know a lot of you are probably saying it needs to be under H for hypertension, but that's not what my patients usually call it. I usually call it blood pressure or things of that nature. Let's kind of give a little background on hypertension or high blood pressure. In the United States itself, probably like 43 million people here in the United States have hypertension or high blood pressure, and it's about 24% of the population. And most of those people are on medication, and because they don't even know, it's called a silent killer. A lot of you know that, because a lot of people don't even know what their blood pressure is or how it's affecting them. They let it go untreated for a long time, and it can lead to a lot of different bad results. I guess I'll start off with what a normal blood pressure is. So you have two components to your blood pressure. You have systolic and diastolic. So systolic is the top number. Diastolic is the bottom number. The common numbers, or the common range for those, is anywhere from 100 to 140 for the top number, anywhere from 60 to 90 to the bottom number. When you talk about high blood pressure, think of this, use this example. If you think of a water hose, everybody's used a water hose, or have seen a water hose in the past. If you block one end of the water hose so that it's obscuring or the flow of the water, then you'll have a buildup in the water behind where the blockage is. And over time, if you get enough of a buildup, you'll burst the pipes, or you'll burst the water hose. And that's the same thing that happens within your body. To look at your body and look at your blood vessel as pipes. And if you block those pipes for any kind of reason, or try to force too much water through the pipes, you can cause breakages in the area. And that's the same thing with your inside of your body. Your blood vessels can only take so much blood volume going through them, and if you send too much blood through them at any given time, or the blood vessels become too stiff, then you can have problems with high blood pressure. Most of the way that we diagnose high blood pressure is kind of funny. We just diagnose it by checking your blood pressure readings when you come into the doctor, or Walmart, Target. A lot of us who have those self-monitoring devices. And on 3 different occasions, usually, or 3 different readings on 2 different occasions, we will check your blood pressure readings. If they're high, like I said before, if they're higher than 140 over 90, then you have hypertension. And what you can do is a couple of things. The number one thing I always tell for everybody, you got to maintain a healthy weight. You got to be the optimal weight for yourself. That helps a lot. Look at your sodium, salt content of your foods. Decrease your salt content of your foods, and exercise and move around. Sometimes these things don't help, and sometimes you have to be on antihypertensive medications. But always you should remember the 3 things I told you. Maintain a normal weight, move around, and make sure that you lower your sodium content. Okay, I hope this kind of gives a little bit of a good overview on blood pressure or hypertension. I'll be back tomorrow with C. Right now I'm having to go see some patients. This is Dr. Damien Sanderlin. Talk to you later.